contingency, and people were so excited, of course, to have you and to have you associated with Tostan. And of course, we are the most honored to be associated with you. And thank you so much for saying yes to our invitation. And I must say, with an enthusiasm and an energy that, you know, was inspiring. So thank you so much for being with us today for such an important conversation. And it's also a very important moment for Tostan. So I'm going to wait a few minutes to allow for more people to join, and then share why I feel very excited today about this conversation and this particular moment. So I feel grateful and blessed to be sharing this with you in particular. So we were expecting more than 200 people actually that confirmed. So we will be waiting a few minutes more. And in the meantime, I'm going to introduce myself. My name is Elena Bonometti. I'm the CEO of Tostan. Tostan is a West African-based organization from Dakar, Senegal. So I'm calling from Dakar, Senegal. And Tostan has partnered with communities at the grassroots for the past 30 years, really to support them, to empower them, to develop and fulfill their vision of well-being, and also has inspired large-scale movement leading to dignity for all. Human rights is at the core of the model that we have, and has really allowed people to promote the abandonment of female genital cutting and child marriage, and the abandonment of other harmful practices, gender-based violence generally, but also really strengthen, I think, the democratic process in the countries where we operate, really towards a more civic engagement. And I think this theme, of course, Mayor, are very relevant to you in your current function. So we are still waiting for a few people to join. And I want to say welcome back to those who have been with us for the two last webinars. This was a series of 3. I would like to remind the audience that this has been a series of 3 about system change. So we started with the co-creating. I mean, it's so important for us when we talk about system change to talk about partnership. And then we moved and we did a deep dive into social norms. So norms that transforms. And then now we are really looking at the local leadership to bring global transformation. I think it's so important today to make that connection between really the local and the global. And I think you, Mayor, of course, you live this in your current function. So we are very excited for this 3rd series. And so they are in the chat. They can say where they are in the chat. Okay. Sorry, I was just waiting to get into the presentation of Mayor. Okay, but then I think people will join little by little. So let me first say to our audience that we would love to hear from you. From where are you calling, who you are, which organization you represent. As I was saying, we have people connecting globally. So from Africa, but also from the US, from many different countries that were really keen in continuing this conversation about system change. So I want to start by quoting you, Mayor, before I get to introduce you a little bit formally. If some of you in the audience haven't seen the TED Talk that Mayor gave, please do so. It's so inspiring and really bringing so much energy to the work that we do every day. So you said in your talk, we needed to talk with people, not at people. We needed to work with the community influencers so that people believed our message. We needed to be talking under the mango trees, not through loudspeakers. What you said resonates so much with me and with all our staff at Tostan, because actually this is what we do. We are conveners under the baobab tree. We use the baobab tree because this is more Senegal. Of course, you have more mangoes in Sierra Leone, but this is what we do. We convene. And during the COVID, we were halted, our operation was suspended because, of course, of the pandemic. And so we felt very strongly that we needed to convene, we needed to bring people around the table, and we thought the system change was really a very relevant topic. And I'm coming to this immediately because I feel it's also very relevant to you in this COVID pandemic. And so we thought that it was important to continue convening, and that's why we started this series. And so allow me to say a few words about Mayor, even if she doesn't need too much introduction. So Mayor was sworn in as a mayor of Freetown in May 2018, and committed really to transform Freetown using an inclusive, data-driven approach to address the challenges of the city. And I really hope, Mayor, you will have the chance to tell us a little bit more about your plan. It's a 3-year plan, which is called Transform Freetown, was launched in January 2019. And of course, we want to hear more about that later in the conversation. So you are a finance professional with over 25 years of the private sector and deeply experienced in strategic planning, risk management, and project management. And then your public sector engagement really began with your work as Director of Planning at the National Ebola Response Center during the Ebola pandemic. And that was 2014, 2015. And then you took the role as delivery team lead for the President's Recovery Priorities, and that was really the post-Ebola program of Sierra Leone. So your advocacy and charity contribution include campaigning against the trade in blood diamonds during the Sierra Leone Civil War, and in 1999, when you co-founded the Sierra Leone War Trust for Children, that continues to support disadvantaged children in Sierra Leone today, and that is an amazing achievement as well. So you are an alumnus of the London School of Economics. You're married with 2 children, so an accomplished professional, an accomplished woman. We are so excited to have you, Mayor. Allow me to ask you to say a few words to add a personal touch to what I just said, and also add for our audience why this theme, the theme of today, local leadership for global transformation, is important to you. Over to you, Mayor. You're muted, Mayor. You're still muted.
Yes.
Elena, thank you so much, and thank you for the kind introduction. And it really is my pleasure to be working with Tostan. So thank you for having me here. To add to what you said, I think maybe the only thing I would say in addition to that introduction is that I think it's become increasingly clear to me in these last 2 years how much can be achieved when we join the dots. It's been surprising. You know, I came into this role from a private sector background, with limited public sector experience, but with a commitment to ensuring that we got people involved. I guess it's because I was coming from a non-political, non-public sector perspective, and I could see that there was something I could add. So it really made me think and made me appreciate the fact that, moving a city forward, addressing the challenges of non-development, climate risk, et cetera, isn't something that's going to be done or needs to be done or should be done by some special group of people. Running as mayor demonstrates the need for you to have political leadership, so that's a very important cadre of people. But getting everybody involved is also something that I've learned a lot. So I think that's what I would add, by way of introduction, a commitment to joining the dots and getting everyone on board.
Thank you so much, Mayor. That's great. So let me tell the audience a little bit about the program today. We have an hour together, and so we want them to be part of this conversation. Of course, I have the honor and the privilege to be able to ask you some questions, but we also want to hear from the audience, and the audience has been amazing and always ask very smart questions. So please, audience, be prepared for 2 things. First of all, to ask questions. So I will be discussing with the mayor 3 major questions, but I will give you the floor each time the mayor finishes to respond to the question. I will give you the floor to ask a few questions as well. And we also have some polling questions, and I think my colleagues just ran the first one. And these are meant to be food for thoughts, and then the results will be published. There are kind of provocative question to you and to check a little bit where you are in the space. So please feel free to join and to respond to those polling questions. So let me start, Mayor, now and ask you about system change. And when we had the chance to first discuss together, you mentioned to me, of course, you had an extensive experience with the Ebola crisis, and that your public service journey started from there. And you told me that you had so many lessons from that experience when you approached the COVID pandemic. And I think when we discussed about system change, you said, yeah, here it is an example of system change. COVID has questioned, the fundamental of our system, and that's why it is so important to relate to this question as a system change question. So, in particular, I would like to know why are local influencers so critical to system change with regards to this, to the pandemic, to the COVID pandemic, and in particular, can you share your lesson from the Ebola crisis and transfer to the way you address the pandemic in Freetown, the COVID pandemic in Freetown?
Right, thanks. So, Ellen, I think the place to start is maybe a clarification or an appreciation of what system are we talking about? If we're saying system change, what's the system that we're talking about? And I'm going to make some assumptions here. We have had a conversation, as you've referred to, but just for the benefit of the listeners, it's important that people understand what we're referring to. And I think it's probably best summarized in the way with your quote from the TED Talk. And the question or the system is our system of communication, our system of engagement, and our systems of intervention. How, and we're talking not just about Africa here, but there are other parts of the world listening in. But Tostan's is based in West Africa, and a lot of the work you do is here. And we're looking at how, therefore, the concept of development is very key to your work, empowering of people for development. So if we talk about a system change, we're saying, how do we change the systems that have been at play to date in this journey, which ultimately has a focus on development, but touches on so many other things as we move forward. And I would say that from the perspective of the Ebola outbreak, a major lesson learned, and this is in the context of a health crisis on a smaller scale than the world is facing today. Absolutely. We had in the end 11,000 plus cases, confirmed Ebola cases in Sierra Leone, and 3,589 deaths. We've just hit the 1 million mark death globally for COVID. So just putting those into perspective, but that notwithstanding, what was required in Sierra Leone in 2014 and 2015 was a massive exercise in getting people to change their behavior. Because as with this pandemic, saving your life meant making some personal decisions about what you would and would not do. It meant not washing the dead bodies of your loved ones. It meant washing your hands. It meant not engaging with someone who was Ebola positive or confirmed Ebola. Of course, it was much more easy to see the symptoms than it is today, with so many people being asymptomatic. But that, the principle of getting people to change attitudes, as we're seeing now, who would have thought that wearing a mask would become such a hot potato and the cause of political tension. But at the heart of this is saying, do things differently. And what we discovered, or what we learned, or what was confirmed, because I'm sure they're bright minds, much more experienced than myself, who've made studies on this. But what we learned on a practical level was that a simple word really held the key. And that word is trust. And trust is not something that appears overnight because there's a crisis and there's a pandemic or there's an epidemic and the Ministry of Health or the National Ebola Response Center suddenly needs to engage you. Trust doesn't just appear because there's a problem. trust needs to be built with time. And in doing so, probably the shortcut to that is engaging those with whom there is already trust. And that is inevitably, by virtue of the tag influencer, you can only influence if there's trust. If there's no trust, you can be a musician, you can be a politician, you can be an academic, you can be whatever you want. If there's no trust, then you are those things, but you're not an influencer. To influence, there has to be trust. And that's something at community level, which is built over time. It's built naturally through community structures. Sometimes it's imposed, so you have a wide range. You have community influencers who live among people, but you also have people who are inspirers. You know, they're musicians who people have never met, but they are able to influence them because they believe in their message. They feel they've been consistent and they've been able to earn that trust. So one of the things we learned, coming back to your specific question, during the outbreak was the importance of tapping into those influencers at the different levels in society, at the community level, at the sort of cross-sectoral level, pretty much wherever you found influence was wherever you saw that there was that trust component. What did it look like? It looked like a conversation, and hence and I will give credit to the person who first said that to me, Dr. Zebulon Yoti of WHO, who's a Ugandan doctor who'd been involved in pretty much every single Ebola outbreak there'd been. And I remember him saying this to me in December 2014, you know, and saying, Yvonne, we need to have conversations with people under the mango tree. We need to be talking to them. We need them to be talking. We need to be talking with them. We need to be listening, and we need to be responding. And I think that decision, which led to a rollout of changes in our strategic plan for the outbreak, was very, very significant. Fast forward now to COVID-19 and what we're doing. In this outbreak, it's been very different, very different. Freetown currently has just over 1,000 cases. And of that number, 73 deaths. So in a city of 1.2 million, that feels very different. And you know, the fact, as I mentioned, that some people are asymptomatic, that there's small numbers of people in treatment centers, it does still touch lives. And you know, there are many people with personal experiences of having COVID patients. But in spite of it being different, that response, the action to break the chain of transmission, to ensure that it does not, you know, irrespective of what the science might be saying about maybe a different strain, our immune systems being different, stronger, all of that's all good, but you don't want to, you don't want to sort of say, I'm going to take my foot off the pedal because it seems to be less virulent here. You still want to do everything possible to ensure that you are still, you know, you're fighting this outbreak. So the lessons of Ebola came to bear. And we have engaged influencers. We've engaged the religious community. We've engaged in community levels. We've set up little sort of leadership groups, which comprise of the Mami Queen, which is sort of a community, a female community influencer, a tribal leader, a youth group leader. So we've got these groups of 10 across our wards, and then groups beneath them. And for the last almost 12 weeks now, we've had teams in the field going, you know, house to house, going to markets, going to lorry parks, with these influencers at the community level, so within a community, within a ward, but then cross community as well. And it's the cross community level where the interreligious group was engaged, where the Ebola survivors as an organization was engaged, because of their own experience. But also importantly, the Slum Dwellers Association was engaged because 35% of our residents live in informal settlements. And when it comes to that question of trust, you want to ensure that you are reaching people who need to hear a message, and you're reaching them with those who they'll trust to deliver the message, but also who can nuance the message to what is real in your context. I remember within the first few weeks of the outbreak of our first positive case, which was 31st of March, going to one of our largest informal settlements, a place called Susan's Bay, with the Federation of Urban and Rural Poor, otherwise known as the Slum Dwellers Association, going with their leaders, because we had had a meeting in my office and we'd said, okay, two big things, two big methods of prevention: hand washing. We've got limited supply of water. We need to deal with that. It's possible. It took quite a lot of accelerating further planned investments, fundraising with development partners, etc., and creativity on the part of homeowners or residents. But that was, it was certainly an easier response than the second one, which is social distancing. How do you physically distance when you live in an informal settlement, when you live in a house or in a, we call them pambodies. So it's a house made of zinc, very limited space, sometimes, 11, 12 people in one small room. How do you socially distance? So we had those conversations, and we went to Susan's Bay together and got the community themselves to engage in that conversation. And we did a video and we asked people, so what will social distance look like? This is our reality. And, we had responses like, well, if there are two or three people sharing a bed, maybe one can be on the floor, and then, other things, other comments around. Where we landed was, okay, well, the disease is mainly spread through hands, so keep your hands to yourself, try not to touch. So it's trying to find creative solutions. And one significant intervention we eventually were able to do, and we have been very fortunate, as I said, with having a high degree of asymptomatic cases. I mean, I know it's global, but particularly here, it's been very important. So the question then was, okay, so if you're in an informal settlement and you are asymptomatic but positive, and we don't want you to spread, you can't isolate safely. So we were able to partner with DFID, EU, and the government of Sierra Leone, who provided the medical staff to establish a community care center with 180 beds, which would be a place that those from informal settlements who were positive but asymptomatic could be safely isolated. So it wasn't, and it meant you weren't going to a treatment center because you didn't really need treatment. You weren't clogging up the treatment center, but this center would provide that ability for you to be safely isolated. So these are some of the things that came out from dialogue, from making sure that we're speaking together and finding solutions together and implementing together.
Thank you, Mayor, so much. What you said resonates so much with what we experience here, on, let's say, the other side of West Africa, the Francophone one, and, the Senegambia. And, there are two things that I want to come back to. And what you said about what is really relevant to your context. Because, in this global pandemic, there was, of course, the more Western solution was the lockdown. And we knew that social distances, as lockdown is not a possible, viable solution. Many countries, including Senegal, did, but it wasn't possible for people to sustain their life, their daily life. Let's not talk about COVID, but really survival issues for more than 6 weeks. And so then we, of course, had to go back to normal when the virus actually was ramping. And so I think from a Tostan perspective, as you said, as I told you in the very beginning, we had to suspend our operations, but we found ourselves shifting gears and become prevention ambassador. Because what we understood that, we needed to create messaging that was relevant to people in the rural communities. There were many messaging going around, do this, don't do that, mostly in French, of course, and in the other languages, in the people that, in the countries that we work. So that's the Gambia, English and Portuguese in Guinea-Bissau. But what about the rural communities that needed to receive accurate messages in their local languages? So we created tools, and we are very proud of this work. We distributed more than 17,000 brochures that were explaining why, the fact that you said, building on the trust that we had with those communities that we have been able to serve for the past 30 years, we were able to, leverage the power of local influencers, as you said, and really vehiculate really the correct messages and the messages that would allow people to make informed decisions about their practices. Because the reality is, as you said, that we needed to change our daily practices. And I think we are very proud at Tostan of what we did, and those brochures have been used by different communities. As I told you, they've been translated now in 16 languages, and they are open source. And I encourage the audience that is listening to still go to our website and download them. Unfortunately, COVID is still with us as we talk, and so we need to continue doing this prevention work. As luckily, we can also resume our normal operation and continuing with our education programming. And I think I have addressed one of the questions coming from the audience, from Atul, who was talking about, yes, the community structure in rural and urban areas differ. And so, Atul, we really try to have solutions that were suitable for the rural communities. And we were very concerned that those, the most marginalized, the more, were not able to have that correct information and to be able really to treat that information as a community as a whole and really make the most informed decision for their well-being. So this question, Mayor, has trust, as you said, at the center, to me brings about the question of local leadership. And we have seen COVID being associated with very different style of leaderships globally. And I think in particular relevant for West Africa is really the question of local leadership. And so there is another polling question, coming to our audience about the government. Is the government engaging actually with those most marginalized in your community? And so what I want to ask you is, in this context, but in whatever context, these countries, our countries, will we face where we need adaptability, where we need resilience, what is the role of local governance? You said very inspiring words about connecting the dots, and I think this is very essential to that conversation. And in particular, what are the barriers that local governments committed to empowering those most marginalized expect to face? Because I know there is resistance when you want to empower that local leadership. So can you tell us a little bit more about your experience in this area?
Okay, so I was thinking about this before we came onto the call, and although we've got a diverse audience, and what I wanted to just turn our minds to is moving outside of where we are now in Africa, and thinking about the evolution or the growth historically of local governance. So in understanding the role of local governments, I think what we need to do is to think about it not just in terms of what it does now, but what it has the potential to do. Because I believe they're vastly different, and they're vastly different because of historical reasons. So if you look at Western Europe, say, where local governance has been around for centuries, uninterrupted, and in fact, it's actually been the bedrock of growth and development. You think of, you know, I was talking to a mayor in one of the Scandinavian countries, and I think that the figures were quite spectacular. I don't want to get this wrong, but I want to say that I think it was over 60% of the national budget is delivered through local government. And this is like in huge contrast to a situation in a country such as mine, where that becomes far less than 10%. I mean, if even 5%. And I think that there's a historical reason. The historical reason is that for many of us in Africa, we're living in countries which were artificially created post the colonial period, national boundaries set, but colonialism itself, in very many instances, not universally, but in very many instances, deconstructed local governance in order to ensure that power was held in the colonial master's hands. And that deconstructing of local governance, that deconstructing of local systems of authority, overlaid with the artificial national boundaries that were created, has made the growth and the strength of local governance in my part of the world. Let me phrase it differently. It has removed the strength and in some ways the relevance of local government. Local government is incredibly important. I am totally committed to the belief that we will only develop as a continent when local governance is strengthened. But I'm just giving some historical background here. So for example, in Sierra Leone, we didn't have universal local government across the country. What we had was suspended in the 1970s. The war, which devastated our country for 11 years and took us back decades. One of the reasons for the war in the Truth and Reconciliation Commission, one of the reasons that was written or documented was the lack of local governance and the consequent lack of sort of fairness of the spread of resources and access to resources, access to opportunities across the country. So a local government act was enacted in 2004. Listen to the year, 2004. Freetown was established in 1893. My local council, of which I'm mayor, was established in 1893, but we're talking about a local government act, which is now defining how local governments is run in 2004. And that even what was written in that act in terms of the devolution of roles and responsibilities, of mandates, of functions, have yet to be operationalized. So as I speak to you, important functions which no one would even think about in other parts of the world being in the hands of local government, such as land use planning, such as building permits, these are still held at central government level. So when you ask the question about the importance of local governance, I feel that it's necessary to first say, but where is local governance? Where is local governance in terms of access to financial resources? Where is local governance in terms of access to space to govern, space to, deliver on mandates? In countries from Senegal to Uganda, I know many local government situations where what is written on paper is not what the local government is able to do. So my starting point has got to be that there has to be a drive. There has to be a drive, because what local government can do is dependent on local government having the space, the political space to do so. So having placed that, down on the table, let me come now to what local government can do. Local government, by virtue of its proximity to the governed, has the real unique opportunity and ability to listen and to respond. We are local. There's a reason for the word local. And I know that certainly in 2004, when I wasn't here at the time, but I'm told the stories by people who were around then. I wasn't living in the country at the time. I was told the stories of people who were around then that people thought that when they said local government, it meant, okay, so we're grassroots. So there's no need for education. There's no need, which there's a level at which, yeah, that can be helpful. There are also challenges with that, because if you are meant to be running a city, it would be useful to have some formal education. It comes in handy with making policy. But there is obviously the very important connection that needs to be there with those whom you are serving. And when you have a situation where you've got high levels of illiteracy, you've got high levels of informality, you want your local governance actors to be able to relate to that. But you don't want to just relate. You need to be able to deliver services, and key among those services is the very education that will change the narrative of the people that you're serving. And so you need to have the equipment. You need to be equipped yourself in order to do that. So local government is positioned, it's positioned by definition at a service delivery level, at a place where through the structure of wards, of counselors, in our context in Freetown, we also have zones, which are smaller subunits of the wards, and ward development committee members. The key word I would use in terms of why we should be able, given the financial resource, given the space to operate along our mandates, the key word I would use would be accessibility. Local governance should be accessible. We should be the ones who are sitting under the tree, and then able, through the process of the council, bringing those ward conversations together and being able to feed them up to national government and influence policy, also drive policy at local level. So that in a nutshell is why I think local governance is so important.
Thank you, Mayor. So inspiring to listening to you, and the time flies. So I really want to give the floor to our audience that has sent many interesting questions. But please let me start by saying thank you for saying two words: listen first and respond afterwards. I think these are key words in what you said. So there is one very interesting question about what you just said, actually, diving a little bit deeper. And the person is asking, I'm sorry, I don't have the name, I will acknowledge immediately. Is there a challenge in making sure that local ownership of actions and responses is prioritized at the same time as partnership between the different sectors? I know your plan, Transform Freetown, really ranges across so many sectors. So how is it possible to both make sure that everyone is reached under the mango tree, and also that groups aren't acting in isolation?
Right, so I think communication is a key word there. So coming back to Transform Freetown, let me talk you through the process of the development of the plan. And Transform Freetown has its roots. So for those who may not, I'm not sure if your intro, Elena, mentioned this, but just to maybe give a little bit more background in terms of my journey to this space. I was driven by the environment and sanitation. So I come from a private sector background, but I got to a point where I was so troubled by the deforestation, the destruction of the natural environment. You can see the picture behind me. This is my beautiful, beautiful city. Freetown is beautiful, but it is under threat. our beautiful beaches, our wonderful mountain forests with, literally disappearing in front of our eyes. And sanitation was also a very major challenge. So that's what led me to running for mayor. But in doing so, you can't be, or I think it's not a good idea to be a single issue person when you're running for office. So I took time to read this Local Government Act of 2004 that I mentioned, and saw in it how much the mayor actually had, at least in theory, responsibility for. And work through that at a high level on a campaign pledge, which was for we community, for we progress, for we Freetown in Creole, which is very easy to understand. I can say it again in English: for our community, for our progress, for our Freetown. And that campaign pledge really is what we repackaged after I won the election into the 4 clusters and 11 priority sectors of Transform Freetown. The 4 clusters being resilience, human development, healthy city, and urban mobility. And the sectors, there are a number of sectors for each of the clusters. So within resilience, sector 1 is environmental management, no surprise, given where I was coming from. 2, urban planning and housing. 3, revenue mobilization, having a sustainable plan for city development and growth. Within the cluster of human development, it was education, skills development, job creation with a tourism focus, see the background. But COVID has meant that we've had to look at this again, and we're actually making it a tourism focus, but with a green focus, sort of a green lens over it. From a circular economy, bringing more of the sanitation into the job creation as well. And then 4thly, persons with disability. So that's our human development cluster. In the healthy city cluster, it's health, it's water, it's sanitation. And then urban mobility, it's urban mobility, both as a sector and a cluster. So what did we do? We started off by engaging between July and September 2018, just after I came into office, 15,000 of our residents in those under the tree conversations. So we had focus groups at zonal levels, 322 zones. And we asked people to rate by accessibility, affordability, and availability their views of how we were doing in delivering services to them. And we got a very clear picture, which was no surprise. We didn't get even 5 out of 10, where 10 is good and 1 is terrible for any of those 11 priority sectors. But coming back to your question, how do we get the balance between the bottom up and the top down? We set technical sector working groups for each of those sectors. We invited the government, central government, to co-chair. So for environment, we had the Environment Protection Agency co-chairing. For sanitation, we had the Ministry of Health co-chairing, so and so on. For the urban mobility, we had I think it was the Road Safety Association co-chairing, Salem Road Safety Authority, and so on. But we also brought in development partners, we brought in NGOs, we brought in the private sector, we brought in community organizations. And those technical working groups took the issues from a technical perspective, looking at things like theory of change. What are the biggest challenges based on research in each of these sectors? What is it we can do? What's going to have the biggest impact? What can we afford? Where can we find money? And so the starting point was bottom up, but the top down is also critical. And out of the combined process, we arrived at 19 targets, which we've published on our website, which we hold ourselves accountable to, and we report every year on where we are, and they're numerical targets. So for sanitation, we're moving from 6% of liquid waste and 21% of solid waste being collected when we came into office to at least 60% by 2022. And at the heart of this discussion were our residents, both from the 15,000, but also the role of an organization like the Slum Dwellers Association, who were key and continue to be key in our work around urban planning and housing, slum relocations. So this is how we've put the two together. And Elena, can I just pick up on one of the questions that somebody's written that I've seen here?
Yes, absolutely. And yeah, and I just wanted to acknowledge that this important question that you just answered to is Rebecca. And she said, actually, I wish the UK had politicians with this level of care of their population and openness to listening. So thank you, Mayor, for saying that. Please respond to the questions that you want.
So somebody asked about social media. And how do you use social media in the context of talking on the, well, so the virtual mango tree, ha, ha, ha.
Of course.
So I think that's an excellent question. And so one of the things we did, there's so many things we've done in COVID. We've done videos. So I've done videos. My counselors have done videos, staff have done videos. And I was inspired by the Prime Minister of New Zealand, who at some point was speaking to her nation during COVID and just kind of like checking in. And in the early days, for about 6 or 8 weeks from May, I did a series on a Monday, Wednesday, and Friday night from 9:15 to 9:30, when it was called Let Me Talk About Corona. Talk to the mayor about Corona, talk to the mayor about Corona. And it were really, really simple. I was on Facebook Live, but it was being aired by a radio station, Air Radio. And they was also on their Facebook page as well. And it was just an opportunity to respond to people and just check in on people and just say how you're doing, and particularly talk about masking, because we had launched the Mask Up Freetown campaign, which saw us give out over 120,000 masks for free to our most vulnerable, particularly our traders and those in the commercial sector. And we've way exceeded the 120,000. I think we're close to 140,000, which represents over 1%. Is that 1%? No, 10% of our population.
Wow, this is terrific, Mayor. Thank you so much for sharing, because, this is so inspiring. And there are many, many questions which are, very interesting, but there are few going back to the resistance, to the challenges that you're facing. And there is one who just came in, and I would like to ask you that question, if you allow me. In what ways does being a woman in public office a challenge and change the system? Because we know you're changing the system within. How are you doing that as a woman, Mayor?
Well, I have been really, really challenged myself. I remember during the campaign, and again, just as a reminder that I wasn't in public sector life, and I certainly never run for anything before, let alone mayor. And I was surprised by the number of times people kept saying to me, so what's your view about being a woman? And I'd be like, I don't get this. I'm a professional. I happen to be a woman. What's with this woman? I get it now. I get it now. I think I was so focused on what I was doing that perhaps a lot of the challenges, the nuances, and even the question itself should have been, should have helped me see where things were heading. It definitely has made a difference. I have been shocked by the level of chauvinism, misogyny that, I have experienced. It has been such an eye-opener. I'm one of 4 girls. My parents raised us as girls who believed that we could do anything, and that's absolutely true. My experience does not negate that in any way. But what I think I have found so surprising is the number of people who don't realize that. The number of people who don't understand that women can do anything men can do, and who also I ran against 7 men, and I won with a 27% margin between myself and the next person. So it was an overwhelming victory at the election, which meant men and women voted. And I still have a lot of people saying, oh, it's great to have a woman. Her approach as a woman is so refreshing. And I guess what surprises me is how those two things sit so well together in people's minds. So let me give you an example of something that happened with one of my staff, my Met Police, my Metropolitan Police. I have a small police force, the city has, I beg your pardon. The city has a small police force. And there was an incident once, and it really, really struck me. So there was a disagreement between two of the Met Police, one a woman and the other a man. And the man came to my office with male colleagues and said that so-and-so, and the name was a unisex name. So at first I didn't realize he was talking about a female colleague. And he said, Sergeant so-and-so, spoke to me in this manner, so disrespectful, even my wife would never do that. How dare she? And I was like, excuse me, what has your wife got to do? You're like, no woman. I was like, I beg your pardon? You are speaking to me and I am a woman. But the way in which he can speak to me and not even realize that what he's saying is so sexist. I mean, why are you comparing your wife and your colleague because she's a woman? Your wife has nothing to do with your office and your colleague has nothing to do with your wife's situation. And this is just a short, sort of a tongue-in-cheek example, but there's so many levels at which this happens, levels at which male colleagues raise their voices. And I'm like, excuse me? I know for certain that if I was a man, there's no way you would be addressing me like that. But what's the good news? The good news is that we are different. That men are from Mars and women are from Venus, as one author put it. You can take that how you want it. But the reality is that physiologically, mentally, emotionally, we are different. We are equal, but we are different. And what I'm enjoying about being different is that there's a lens that I do bring as a mother, as someone who's, who thinks about things that maybe a male colleague wouldn't instinctively think about. And when you're running a city, I think that can be very helpful because I often feel like the city is my home and I'm very house proud. I want my home to be tidy, to be neat, to look good. And I feel the same way about my city. And I care about everyone who lives in my home. And I feel the same way about my city. So yeah, we're different, but some of those differences can be very beneficial when you're in a position of responsibility, which can actually, you can bring some nurturing instincts. That's not to say men don't have nurturing instincts, but I feel that I definitely have instincts which can be applied helpfully in the context of city leadership.
Thank you, Mary, for sharing. That's so interesting to hear your perspective. Allow me to bring in more stakeholders or the perspective, or maybe your message to go to different stakeholders. There is a question coming from our friend and supporter, Susan Fine, and I will ask you to respond with few words if possible so that we can go to a last one. So what are the best ways that philanthropic organizations and government donors can support greater civic engagement? Do you have a few sentences message to your key stakeholders in your daily work?
Right. So one of the key ways, I think, is for us not to work in silos. I mentioned at the beginning that, I love the concept of joining the dots. And if you look at the Transform Freetown graphic, because we sort of have a simple graphic that says what Transform Freetown, how it lists the clusters and the priority sectors, and then who, and it has a circle and it has all the stakeholders, so public sector, private, and social actors. And I think the short answer is, how do we do this best? is by working together, because civic education isn't nothing that we do in city life should be done in silo. The very nature of engaging in sanitation, engaging in urban planning, engaging in education, engaging in environmental management. So environmental management, let me give you an example of something we're doing right now. Freetown, the tree town, we're planting 1 million trees to address serious issues of flooding, erosion, water catchment, and beauty, lost beauty. And to do that, we're enlisting Freetonians as tree stewards. So so civic education happens as a result, as an offshoot. You know, you're given the opportunity, someone comes to your door, says, do you want to be a tree steward? Do you want to plant trees? We're going to monitor them. We're going to track them. We have an app. Will you sign up? Will you register? We'll take photos. We'll come every month and see how the tree's doing. And you can do that if you live in a slum community, and you can do that if you live in a nice house. But the process of engaging is in itself civic education. The process of engaging on our drive to ensure that our city is clean, you know, by making sure we're getting everybody to sign up to have somebody collect their waste. Again, you know, we've just had a cleanup in a community on Saturday, a community under a bridge called Congo Cross, and an illegal dump site had sort of emerged there. We cleared the dump site, but we engaged the community. And we sat with the residents this is an informal settlement. So this is illegal, principally illegal structures, some of which have to be removed because they're a risk to themselves and to the rest of the city. But in the context of waste management, they have been illegally dumping. So we got them to agree that they would coordinate themselves, have a specific day of the week where a tricycle would come, one of our authorized tricycles. They would pay small amounts of money, but because they're doing it collectively, they'll be able to pay the tricycle to have the waste removed. And we'll monitor that. This is not a perfect solution. We don't have utopia in Freetown. We're not getting it all right by any stretch of the imagination. But we're taking risks. We're doing experiments. We're trying to speak to our people. We're respecting our residents. And we're hoping that we can get the buy-in for us to have solutions that are collective.
Thank you. Thank you so much, Mayor. We are unfortunately moving towards the end. We just have 2 minutes left, and we are very conscious of people's time. I just want to start thanking you and all the team that has put this great event together. It was a privilege really to be speaking with you. And I really want to thank all the audience, and all the wonderful questions that came in. I think we could have spent hours talking with you. So thank you so much for sharing. Let me close as I open up by quoting you again from your TED Talk that again was so inspiring. And you know, that TED Talk talks about the anger and the frustration. And you said that that deep sense of anger and frustration I felt didn't fold magically or clearly, but that's not how the power of this satisfaction works. It works when you know that things can be done better. And it works when you decide to take the risk to bring about that change. So Mayor, let us close this wonderful conversation on a very positive note. You're bringing so much change in Freetown, and we look forward to see the greatest achievement that you're going to bring in that city. And I really encourage the audience to follow you and to follow that deep sense of commitment to bring about that change. I think the world today needs that change that we need to make happen. Thank you for being with us today, Mayor. It was an honor to host you. And thank you to all our wonderful participants. And let's look forward to continue this discussion about system change. I'm sure Tostan will convene more. And Mayor, we will be so grateful to have you again with us soon.
Thank you. Thank you very much for having me.
Thank you so much. And thank you to all of you.
Thank you to the participants as well. Thanks. Have a great day.
Thank you. You too. And all the best in Freetown. Thank you.